Hi parents, I'm Dr. Shivani Deswal. I'm a child liver specialist in Gurgaon. Today I'm going to talk about life of children post liver transplant. I am often asked by parents that what are the chances that my child will survive a liver transplant and what is the care that I need to give to my child after liver transplant. 20 years back, if you see, children with untreated biliary atresia, metabolic liver disease, liver failures had a very hopeless future. With the advent of liver transplant, the life has changed, and children with end stage liver disease are now being given a new lease to life. But the new liver needs to be respected. The survival is more than 95 to 98% post liver transplant surgery in most of the centers. The 20-year survival has been seen to be more than 80% in children who have been on regular monitoring and follow-up. It is very important that parents need to be aware of immediate and long-term side effects and monitoring that is needed in children post-liver transplant. Liver transplant is a complex surgery. It involves 8 to 10 hours of operation theatre, followed by 5 to 6 days of ICU care, followed by ward care of around 2 weeks before your child is discharged from the hospital. In the immediate post-operative period, sometimes there are vascular or biliary complications which can be easily taken care of. Also, the child is at a risk of infection. So asepsis and hygiene is paramount in the first 3 months of post-liver transplant. Once the child has overcome the first 3 months of liver transplant, your child transits to a normal life slowly, and by 1 year, the child comes back to school. The parents need to be aware about the immunosuppression that their child is getting and what are the possible side effects and how they need to monitor the doses of the immunosuppression. The parents need to know the regular blood test that the child will need. Initially, we do it every 15 days, then we shift on monthly, then we shift it on to 3 monthly. So the parents must comply to the blood investigations prescribed by the pediatric hepatologist. Then the parents also need to follow the vaccination schedule after 6 months of liver transplant, which the pediatric hepatologist tells them to do. The parents need to understand that it's not only the infection and the immunosuppression. The child's overall health and the quality of life also is a focus for us. We need to make sure that child's psychological and mental development and growth and well-being is also being looked into, which needs regular consultation with your doctor. Even long-term transition from child to adolescent to adult hepatologist is now being looked in India, and we need a smooth transition of these children to adulthood. We need to monitor their renal function test. We need to monitor these children for metabolic syndromes. We need to monitor the children for their psychological development and make them healthy individuals and respect the new liver that your child has got.